Medical University of South Carolina is kicking off a brand new clinical trial this week, making the hospital the first clinical trial site in the country to test this technology.
MUSC will be testing a new cochlear implant for people with hearing loss in an effort to break the barriers of those implants and to help more people be able to hear and communicate effectively.
Our Autumn Klein joins us live from outside of MUSC now to tell us a bit more. Good morning, Autumn.
Good morning, Nick and Katie. This new type of cochlear implant is completely internal. It will go underneath the skin. It will not be visible from the outside, so if successful, it can provide a number of different benefits in comparison to a typical cochlear implant. A traditional cochlear implant requires charging and typically is not worn at night, so patients often have safety concerns with being unable to hear things at night. A typical cochlear implant also poses the risk of falling out during activities like sports or swimming. This new implant, created by Envoy Medical in Minneapolis, allows a patient to have 24-hour hearing, and it only needs charging every 4 to 5 days, which can be done at night while it is still worn. The implant uses the body's own natural hearing process to detect sound, and the battery sits inside the chest. So the charging process just requires the patient to wear a simple pad on their chest while they sleep. The surgery is about 2.5 hours longer than a traditional cochlear implant. I spoke with Dr. Teddy McCracken, who is leading this trial here at MUSC. He says that they do over 200 cochlear implants a year at MUSC currently. However, only about 5 to 10% of patients who need the implant will get it because of the physical appearance and inconsistency of it. So he believes this trial could change the lives of many.
Being in the medical field and a surgeon, we kind of don't really consider the cosmetic issues that patients may have as much as patients might consider that. We get very used to we get very used to cochlear implant technology, right? We see it on our patients every day. We're very used to seeing it. We don't notice any kind of thing being unusual about it. But there's patients out there who that is a barrier to getting a cochlear implant.
Enrollment for this trial just opened last week, and they're still actively accepting patients. They will begin testing candidates this week so they can get started. But for more information about the trial or how you may be able to qualify, you can visit this story on live5news.com. Live in Charleston, Autumn Klein, Live 5 News.